Hello, welcome back to Med-Surg Mentor. Today we will discuss an interesting disease condition from cardiology, which is cardiomyopathy. In this presentation, let's see the etiology, types, pathological changes, clinical presentation, management, and nursing care of cardiomyopathy. Let's get started. Now let's move on to the definition of cardiomyopathy. Cardiomyopathy is an irreversible primary disease of the heart muscle, which is resulting in ventricular dilation, wall thickening, reduced contractility, and conduction disturbances. Pathological changes in cardiomyopathy. Characteristic changes are ventricular dilation, wall thickening, interstitial fibrosis, reduced contractility, and conduction disturbances. Now let's see the etiology of cardiomyopathy. The common etiological factors are idiopathic causes, infectious causes like viruses, metabolic problems, toxins like alcohol and cocaine, connective tissue disorders, and genetic predisposition. Other common etiologies leading to cardiomyopathy are autoimmune disorders, neuromuscular disorders, cytotoxic drugs like daunorubicin, doxorubicin, and idarubicin. Now let's move on to the types of cardiomyopathy. It is categorized into three, and they are dilated cardiomyopathy, hypertrophied cardiomyopathy, and restrictive cardiomyopathy. Let's see each one in detail. Now let's move on to dilated cardiomyopathy. It is a condition in which the heart muscle becomes weakened and enlarged. As a result, the heart cannot pump enough blood to rest of the body. Common causes of dilated cardiomyopathy are genetic factors, chemotherapy, myocarditis, viruses, autoimmune disorders, and toxins like alcohol and cocaine. Next is the pathological changes in dilated cardiomyopathy. Changes commonly occur in the ventricles. Due to the etiological factors, myocardial fibers are degenerated. As a result of this, the viable tissues are replaced by fibrotic tissues which are non-pliable. Since these muscle fibers are fibrotic, it affects the contractility and stroke volume. Gradually, there is a marked reduction in contractility and stroke volume. Finally, it leads to low ejection fraction and cardiac output. Clinical features of dilated cardiomyopathy are dyspnea, chest pain and palpitations, nausea and vomiting, peripheral edema, abdominal distension, fatigue, and reduced ability to do exercises. Diagnostic measures of dilated cardiomyopathy. In physical examination, common findings are S3 heart sound and murmurs. Blood test is done to rule out inflammation and metabolic disorders. Echocardiogram is done to rule out chamber enlargement and blood flow alterations. The common ECG findings are ST T-wave abnormalities, bundle branch block, and tachycardia. Other diagnostic measures of dilated cardiomyopathy are chest X-ray, cardiac CT, and MRI. It is done to visualize the heart to rule out cardiomegaly. And the last test is cardiac catheterization. It is done to measure pressures within each chambers of the heart and to collect tissue sample for analysis. Next is management of dilated cardiomyopathy. Commonly used drugs are inotropes like digoxin, angiotensin converting enzyme inhibitors, angiotensin II receptor blockers, beta blockers, diuretics, ivabradine, and anticoagulants like heparin. Now let's move on to the support devices used for treatment of dilated cardiomyopathy. The commonly used devices are left ventricular assist devices, implantable cardioverter defibrillators, and biventricular pacemakers. Let's see each one in detail. First one is left ventricular assist devices. It is a temporary support therapy for people waiting for cardiac transplant. It is a mechanical device that is implanted in the abdomen or chest, and this is attached to the weakened area of the heart to help in pumping blood. The second one is implantable cardioverter defibrillators. It monitors heart's rhythm and delivers electrical shock to control the abnormal rapid heartbeat. Third one is biventricular pacemaker. This device sends out electrical signals to control contractions between left and right ventricles. Thus, it helps for the ventricles to contract more normally. Now let's see the surgical management done to treat dilated cardiomyopathy. And the surgery is heart transplantation. It is done as a last resort to treat cardiomyopathy. It's a surgical procedure in which deceased failing heart is replaced with a healthier donor heart. There are mainly two types of heart transplantation. They are orthotopic transplantation and heterotopic transplantation. In orthotopic transplantation, a large portion of right atrium and left atrium are removed, and then the donor heart is implanted into the atria. In heterotopic transplantation, donor heart is placed parallel to the recipient heart. Common nursing diagnoses for patients with dilated cardiomyopathy are decreased cardiac output, impaired gas exchange, ineffective tissue perfusion, acute pain, fear and anxiety, excess fluid volume, and deficient knowledge. Nursing care of patient with cardiomyopathy. Assess vital signs, heart sounds, and oxygen saturation. Assess for signs of decreased peripheral perfusion. Administer supplemental oxygen, and educate patients on stress management. Other nursing cares are assess and analyze arterial blood gas values, ensure fluid and salt restriction, encourage small and frequent meals, elevate head of the bed to semi-follows position, and teach deep breathing exercises. So far we have seen regarding cardiomyopathy, its definition, etiology, and types. In this presentation, I have covered the first type, that is dilated cardiomyopathy, in detail. Let's see the other two types of cardiomyopathies in the next presentation. If you find this presentation useful, please like, share, and subscribe. Thanks for watching.